So in the US alone, there is 2.5% of children that are suffering from depression today, more common in boys under the age of 10, and then when girls reach the age of about 16, it is more common in that age group. Babies, children, teenagers who have depressed parents are at a higher risk of exhibiting elevated levels of depression with mild to severe symptoms, but then they can also begin suffering from anxiety symptoms than children with non-depressed parents. Because depression can run in families, we can actually even say it's genetic. Children who have one or both depressed parents are at a high risk of suffering from depression themselves, but then these children can also run the risk of physical self-harm. They may start experimenting with drugs, with alcohol, thus becoming substance abuse users to withdraw from the life that they're living. But then these children can also then begin suffering from socializing skills. The earlier depression is diagnosed and treated, the better the chances of success. Treatment for both the child and the adult, so the parent, are very similar and involve medication. It can involve therapy or both. The National Institute of Mental Health actually listed a few treatment options for depression, which include antidepressant medication, which can take a little bit to begin working, but really can be efficiently helpful for depressed patients by increasing the way that the brain uses chemicals. There is also psychotherapy, which is an evidence-based approach specific to the treatment of depression, which include cognitive behavioral therapy. It also includes interpersonal therapy, and then also problem-solving therapy. As a last kind of resort, there is also a treatment called brain stimulation therapy, which is used to treat depression when medication, when therapy, or a combination of both have not worked. Then electroconvulsive therapy would then be introduced as a treatment option. It really is important to understand depression because there is a connection between parental and child depression. There is that correlation. And because depression is a mood disorder, it can affect and it can disrupt everyday living without treatment. But with the right treatment, depression does not have to be part of an everyday struggle, and individuals that are suffering can get help and can get better.